Hello, everyone. Welcome back to our pregnancy and chronic illness lecture. So we're going to start back with hypertension as our second chronic illness. So starting with epidemiology, it's important to note that hypertension in pregnancy is the most common medical disorder. So 6 to 8% of pregnancies have chronic hypertension. Chronic hypertension being defined as hypertension that the patient has before they become pregnant. And then 2 to 17% of pregnancies have gestational hypertension. So gestational hypertension being hypertension that develops at 20 weeks of pregnancy or later. Additionally, preeclampsia is a complication of hypertension. We will get more into the definition of that later in the lecture, but about 2 to 8% of pregnancies will result in preeclampsia. 13% to 40% of pregnant women with chronic hypertension will have preeclampsia. And this is often associated with severe complications, once again, like we will get to later in the lecture. It's very important to note that hypertension and hypertension/preeclampsia will cause 16% of pregnancy-related maternal deaths. So this chart outlines the risk factors for a patient developing preeclampsia. Just to go over a few, if the patient has gestational diabetes, if the pre-pregnancy BMI is greater than 30, and if the maternal age is 35 years or older. So like asthma, it's important to understand how pregnancy can induce some blood pressure changes. So surprisingly enough, blood pressure will actually lower in the first half of pregnancy. We can expect a drop of about 5 to 10. Additionally, it may go back to normal or even slightly elevated by about 10 by the third trimester. We can also expect to see an increased cardiac output, by that being blood volume increased by 30 to 50% after week 6. Additionally, we could see an increase in renal function by about 50%, the max by week 16. This is important because an increase in renal function it can then stimulate our RAS system, which could then lead to an increased blood pressure. So ACOG, or the American College of Obstetrics and Gynecology, were the main ones who put out the guidelines for pregnancy-related complications. So they outline the different types of blood pressure disorders we can see in pregnancy. So as mentioned previously, we have chronic hypertension/preeclampsia, gestational hypertension, preeclampsia to eclampsia, and then severe hypertension. So they just outlined here at what week we can expect to see these, the blood pressure cutoffs for diagnosing these, as well as if the patient needs a history of hypertension to fall into the categories, or if it's something that the onset happens during pregnancy, and then if proteinuria is present or not. Specifically, just want to highlight that proteinuria is defined as greater than 300 milligrams of protein in a 24-hour protein collection, 24-hour urine collection, or a protein to creatinine ratio of greater than 0.3. So this table outlines the associated risks with having hypertension in pregnancies. So having hypertension can result in risk to the mother or trans man, to the pregnancy itself, and then to the fetus. So you can go through those. Additionally, it's very important to understand the different indications to treat hypertension or not. So as you can see here, there's a lot of different national guidelines or resources that have different blood pressure cutoffs. So I don't want you to get too lost in this. We can generally follow a recommendation of treating when blood pressure is greater than 140/90. And as you can see mentioned here, a lot of the times it's based off of if the reading was done at home or in the office. So typically there's one cutoff for if the blood pressure is in the office. So if we look at the last one, the International Society for the Study of Hypertension in Pregnancy, they recommend to treat if the blood pressure is greater than 140/90 in office or greater than 135/85 at home. Additionally, each guideline gives recommendations of what our target blood pressure should be. With that, I will pause and we can start back at the next video with going over our preferred antihypertensives, treatment, and preeclampsia.